start the recording. Thank you. We're having, bear with us this evening, because I think we're having lots of technical issues this evening, but we'll work our way through and hope that everything comes together. So my name is Jackie Demirovska, and I'm one of the group facilitators from the Cornerstone team who are hosting the events tonight. Obviously, we're working with Dudley Council, with Anne Horder and the team from Dudley Council, who are from Public Health, from the Community Development team, and of course, Communications. And also the TCT, Transforming Communities Together, with James Henderson and his team from the voluntary group. I just wanted to quickly, I just wanted to quickly refer to last week, as we had a very thorough and informative session on diabetes, obesity, and working towards a healthy lifestyle. It'll be interesting, what did we all do after that session? What did we eat? What was the size of the plate? There were so many, nuggets really of information that we looked at for type 2 diabetes and the complexity, of carbohydrates and other food groups. There was a lot of good information on what's available in the Dudley and surrounding area for a healthy lifestyle, and information as well on, sort of sports England, and what we can do even at home if we're not able to get out to some of these activities. So we hope that everyone took on board that information. The other thing I wanted to just say that we're all going to refer to, the speakers will refer to, and of course we use this term BAME, which is Black, Asian, Minority, Ethnic, but I think it's really important just to say generally to the community that not everyone obviously agrees with this term, not everyone understands this term, and it means different things to different people. So when we're using that term, of course, we're talking, I think there's 18 ethnic groupings that are used in the UK. I think Dudley Council, use at least 14 of those. So we're looking at the differences, whether you're from a Bangladeshi community, whether you're from a Roma community, whether you're from a South Asian community, whether you're from an African Caribbean community. There's, so much difference. So we just need to, and I'm sure, we are mindful of that. So we're not obviously grouping everyone together, but I just felt it's really important to clarify that. And also the racial disparities, which I know our speakers will refer to, which are some of those underlying socio-economic conditions and health inequalities as well. And also, I just wanted to remind us from this programme, linked with the National Public Health Report, how it talks about the importance of engaging with stakeholders. So obviously the stakeholders are from the community, and with the community holding so much insight. So in our working group, we used an analogy of a cake, and actually who's looking at the ingredients to make that cake, to make it palatable for the community that we serve. So again, it's just really important to recognise the importance of yourselves attending tonight and contributing to the discussion. The community participation, it's seen as equal partners in all steps of the process. And I'm sure, maybe Anne and the community development workers can talk later about, the BME subgroup, which was mentioned, well, it's actually been mentioned the first 2 weeks, but also about, what are the opportunities that the report talks about to kind of fund, develop and implement culturally competent COVID-19 education and prevention campaigns? And also, how do we accelerate efforts to target culturally competent health promotion and disease prevention programs? Obviously, including areas of chronic conditions, hypertension, asthma, and what we're going to be talking about tonight. So just before I introduce the speakers, also to let you know that you will have the opportunity, as I say, to put your questions to the chat. Our speakers will answer to the best of their ability. If they're not able to answer, you can use the Dudley Council Healthy Communities email, and our team will put that information out for you on the chat. And at the end of the recording, you will also have the opportunity for a informal meet and greet, and that session is not recorded, so you're free at that point to keep your videos on and introduce yourselves to the community. So I will just introduce our speakers, and I want to again thank them in advance. We've been having some excellent speakers, and I know tonight will be no different. It will be exactly the same, and we really want to thank them for their time. So we have Dr. Randa Abasaid El-Hag, we have Joe Hamilton, we have Russell Tipson, and we have Kuldeep Chana. So the first speaker this evening is Dr. Randa, and I'll hand over to Dr. Randa now. Thank you very much.
Hello everyone, thank you very much for inviting me to speak today. My name is Randa Abasaid El-Hag. I'm a consultant in acute medicine and medical high dependency at the Dudley Group NHS Foundation Trust. Today I'm here to speak about the clinical understanding of COVID-19 and its relations with chronic illnesses. Next slide, please. During the course of my talk, I'll talk about the cause of the disease, those who are at high risk, and the general approach on how to live with chronic illnesses during COVID-19 pandemic and any helpful resources. Next slide. Novel COVID-19. Coronaviruses are a large family of viruses. Some cause illnesses in humans, other in animals. Human coronaviruses are common and are typically associated with mild illnesses similar to the common cold. At the end of last year, a novel coronavirus caused a cluster of pneumonia in Wuhan, China. Unfortunately, that rapidly spread, resulting in global pandemic. The virus that caused COVID-19 is designated as SARS-CoV-2. Next slide, please. It's a very new illness to health professionals at very unprecedented and challenging time. A lot of ongoing work on research, on treatment, vaccines, a lot of new data are going on, and guidelines have been constantly updated. We have been all the time trying to look at new evidences. Next slide. The typical symptoms of the disease: dry cough, fever, loss of sense of smell or taste. It could come with some respiratory symptoms as breathlessness or chest pain, some neurological symptoms as headache or delirium, some flu-like illnesses, fatigue, muscle aches, chills or rigors, and some gastrointestinal symptoms as nausea, vomiting, and diarrhea. So actually, the symptoms are ranging very non-specific symptoms. Next slide. Some remain asymptomatic, and what we call them the carriers. Most of people will have mild course and will be able to stay at home, do not need to present to any health professional. However, some patients who initially have non-severe symptoms progress to develop pneumonia, and these are the people who would need to present to hospitals, and that in the way that they were breathless, their oxygen levels would be low, and unfortunately some others will even develop more critical diseases, like we will see some organ failures, like either in the lung, the kidneys, the heart, or they can go to shock and multi-organ failure. Next slide, please. We've managed to identify people, so far managed to identify people who could be more riskier than others in getting the disease and getting worse symptoms and possibly need to admission. BAME ethnicity, particularly those who are aged above 55 and have got comorbidities. White European ethnicity above the age of 60. Some people who do suffer from illnesses like hypertension, heart diseases, the diabetes, chronic kidney diseases, people on dialysis, people who have got renal diseases. Next slide. And people who has got respiratory problems like asthma, bronchitis, COPD, some chronic neurological conditions like multiple sclerosis, cerebral palsy, motor neuron disease. We identify people who have got cancer, especially people who has got hematological cancers, lung cancer, and immunocompromised patients who have could be people because they take some medication who will cause their immune system to go low, or if you have got problem with the spleen. Pregnant women have been identified to be high risk, male gender, and severely overweight population. Next slide. So we've identified that some of the BME population are high risk. People from Black ethnic groups were most likely to be diagnosed. Unfortunately, death rates from COVID-19 was identified as highest among people of Black and Asian ethnic groups. People of Bangladesh ethnicity had twice the risk of death from other white British ethnicity, and I've identified more people from other BME population, from Chinese, Indian, Pakistani, and Asian Caribbean, to have 10 to 15% risk of death on comparison to white British. Next slide, please. This analysis did not take into account any other effect of your job, comorbidities, or obesities. All of these factors is very understood that it's a high risk of acquiring COVID-19 or high risk of dying. From the BME ethnicity, it was found that diabetics as well as hypertensive are more higher risk than other population. Next slide, please. So now we identified people who are high risk. So what is the next step? So you've been identified, patient that you ideally people should follow what's the current NHS, the guideline of Public Health England and the NHS England guidelines. If you are needing an appointment, attend your planned appointment. Hospitals have taken a lot of care scheduling these appointments, ensuring that when you come in, there's less people in the waiting area. Try to stick to your appointment time, because that will drop down the risk for you meeting other people. If possible, use your own transport. And please do take your medications, except if told otherwise. And there's a lot of facilities now to keep in touch with your medical team. So do please keep answering or returning phone calls. And if there's any letters, please do call back. Next slide, please. On the other side, there are things which people could do about it, like modifiable risk factors are similar to what we talked last week. Speakers from last week about diet, losing weight, exercise, keeping active, stop smoking. Flu vaccine. Most people in this group will fall on people who has been sent letters or reminders of flu vaccine. Do take flu vaccine. And although it does not prevent coronavirus, however, people who has got the flu are more riskier to get other illnesses. And on the other side as well, things could be done is to slow the spread. What we've been doing for the last few weeks or month, keep up to date with what's going on with the national guidelines, practice social distancing, wearing facial mask, washing your hands, hygiene, avoid touching your face, avoid unnecessary traveling. Next, please. Despite all this, some people will become unwell. So what to do in that instance? The first spot will be your team. Contact your team, especially if it's within hours or if you've got a number for them. There's sometimes some hospitals will provide direct ward reviews. If not, you'll be asked to go to the emergency department. And please do come to hospitals. It's safe. The environment has been made to be safe. Testing is important to differentiate from other infections. There's no way with all the symptoms I've said, which could be mimicking other diseases, to know without the test. And as well, you need an expertise to differentiate between the symptoms and your existing illness. Take into account your respiratory problems or chest pains and all of that. You would not be able to differentiate it without without the clinician help. And some complication of COVID-19 could mimic the disease. And that's why you need to come in. Next slide, please. So other things we do in hospitals that obviously we will assess you, we will optimize your medical treatment, we'll try to do a safety net. We will balance you staying in hospital versus discharging you. And when we discharge you, it will be a planned discharge. Then we will individualize every plan. Like each person is different. Chronic illnesses, some person might have one illness, the other might have multiple ones. We will individualize the plan, and then things will be initiated as a follow-up. The patient-initiated follow-up in the way that we will give patients access for a number for the ward to ring the ward if there's problems. We will keep virtually doing some clinics either by phone or by video calling. Ideally, we'll try to keep the patient on the same team. And we will telephone the patients electively in the way that let them know what their investigations and the management plans. As well, we will communicate with the GP and with the community nurse. We're all coordinating together with community nurse team and our GP colleague. We'll try to break the work among all clinicians as efficiently and as safe for the patient. Next slide. Okay, please, next slide again. So I'm going to talk in the next couple of slides about just cardiovascular conditions and respiratory conditions briefly, renal diseases briefly, as the next speakers will be speaking about respiratory. In general, like if you have cardiovascular disease, please follow what we said earlier about the general advice. Keep in touch with your specialists. Cardiovascular disease are a huge number of diseases. There's people who has got heart failure, people who's got have got arrhythmias, people who's got pacemakers, those who has got coronary syndromes or presenting with chest pain. We will advise you to hydrate yourself and be careful with heart failure as well, so don't overhydrate. And we, in particularly with the medications, I'm just stressing that people should not stop medications. Do not stop any ACE inhibitors or ARB therapy, which is used for hypertensive and for heart failure and for some particular heart conditions, except if you've been advised otherwise by your clinician. There's a lot of valuable resources found for the public on the British Heart Foundation websites. Thank you. Next one. Similar advice I would give for people with renal conditions, on specifically that to prevent dehydration. Obviously, that does not apply if you're on dialysis or you would not normally pass urine. But the reason I'm talking about dehydration, because the illness of COVID itself will cause you to have temperature, you will sweat, you will lose insensible loss, plus some people could develop diarrhea, and that we need to keep up topping up with fluids. And there's a lot of good advice about chronic kidney disease from Kidney Care UK, and as well there's this guidance for patients with kidney disease. Thank you. Next one. These are sort of helpful resources I found from British Heart Foundation, for NHS UK England, and the British Thoracic Organisation and Kidney Care UK. Next, please. References for my talk. And the last thing is, next please, is a conclusion of what I've said, is that we need to be aware that there's a lot of comorbidities and being male gender elderly population are more likely to have serious illness and thus acquiring hospital admission. BME community had worse outcome as compared to white. And Covid-19 not only affects respiratory symptoms, but it does affect other symptoms. So we need to be aware of that. Thank you very much.
Thank you, Dr. Randa.
Thanks.
Thank you so much. We'll hand over to Joe Hamilton.
Good evening, everybody. Thank you very much for inviting me to speak to you this evening. My name is Joe Hamilton. I'm a lead respiratory nurse in Dudley. I've worked in Dudley for over 30 years. I started off as a practice nurse back in the 80s, and I've worked in various practices across Dudley. And my role now is a lot around education. So I work a lot with the nurses, the GPs, healthcare support workers, anybody really that comes, any healthcare professional that comes into contact with people with respiratory conditions. Because if we can have well-educated healthcare professionals, then we know they can provide better care to you, their patients. So I spend a lot of my time now across the Black Country as well. And I work very closely with our respiratory lead clinician, who is a GP in Dudley, Dr. Hopkin. So we will plan very carefully, and we will look at data, and we will see where the needs are and what we need to address. And my messages tonight are really quite simple. So I've been asked to talk about asthma and COPD. Now, when we do these topics with our healthcare professionals, they can each take a minimum of a day, and some of the courses are 6 months long. So I'm going to try and put very simply to yourselves as service users. So asthma and COPD, they are both respiratory conditions. Now, there are lots of other respiratory conditions as well, but I am making a particular focus. I've been asked to talk on these this evening. So asthma predominantly starts in childhood. So a lot of asthma will start as children. The big difficulty we have with asthma is it isn't easy to diagnose. There isn't a simple test that can be done to diagnose it. So if you're having symptoms of cough, wheeze, shortness of breath, you've got a family history of asthma, you may have allergy, you may have atopy. We look for a cluster, we take a good history. And some patients come in and they get a little bit impatient because they want a diagnosis straight away. And unlike diabetes, we can't do a blood test to confirm that. So we have to do a series of, a combination of a history and different tests. So don't get impatient if you feel your diagnosis isn't coming through. And the added thing we have at the moment is we can't do some of the respiratory tests because it means blowing out hard and fast. And that's what we don't want to put into the environment. So it is a little bit different at the moment, where we're relying a lot more on the clinical history. So COPD is also a chronic obstructive condition, and it's an umbrella name. And COPD is something that starts later in life. So we tend to look for patients who are over the age of 35. Now, the main cause of COPD is predominantly smoking. So people who have smoked for 20 years or more on 20 cigarettes a day, and that's generally toward by the age of 35, then these are the patients who are at risk of developing a chronic condition. And in the UK, we start smoking between, when I say we, I don't mean we, I mean as individuals, between the age of 9 and 13. So by mid-30s, you can have done a lot of damage of 20 years of smoking to your lungs. Now, I've got some airways here that I'm hoping you can see. So when we look at, these are what the very tiny little tubes, so these are a lot bigger. We like the airways to be nice and relaxed and have a lot to be able to breathe in and out. Now, when someone has got an obstructive condition, the airways can become very tight and inflamed. So when you're trying to breathe, it's far more difficult. Now, when you've got COPD, the airways can gradually fix and they won't be able to go back to normal. But in asthma, treatment, we give patients treatment and it does reverse back to normal. So these conditions are very different. They're two completely different conditions, although asthma can lead to COPD. So I don't want to get too technical because there's some simple messages here that the most important thing that you need to do is to take your inhalers as prescribed. Now, when we give patients inhalers, if you've got asthma, you will be given preventer treatment, which is an inhaled corticosteroid, and it needs to be taken regularly. But if you're not taking it regularly, it can lead to a lot more problems. So it's really important that you use your inhaled steroid regularly. Even when you're feeling well, when you've got asthma, you need to be taking your treatment regularly. Now, if I tell you that it's about 5% of people that actually take their treatment regularly, and the biggest factor pre-COVID was that patients didn't comply with treatment. And when we look at the National Review of Asthma Deaths, people who died with asthma, the most overwhelming factor is that they don't take their inhaled steroid regularly, but they do take the blue inhaler. So those of you who've got asthma will be very familiar with the blue inhaler. And that is the one that is for symptoms. It doesn't treat your asthma. So if there's one message I can give you today, and the message we're trying to give nationally, is the preventer inhaler is the one that you need to be taking regularly. And this is what we're doing a lot of education in practices with. And when we ask you what inhalers you take and how often you take them, the majority of patients are using the blue inhaler. The blue inhaler, overuse of it is a contributory factor to fatalities. And good controlled asthma, you should not be using any more than 2 blue inhalers per year. This is when you have asthma. And we know that the majority of patients are ordering 1 blue inhaler per month. So this is why it's so important to attend your review. And particularly at the moment, it's important that you attend your review on time, because we're working really hard in general practice to minimise contact as much as possible. But a lot of the practices that I'm working in, we're doing video consultation or telephone consultation. So you will have an opportunity for video and telephone consultation, but we are also offering face-to-face where we feel it is appropriate. So not only should you be using your inhalers as they're prescribed, but you need to be using them correctly. And again, very few people use their inhalers correctly. So I spend a lot of my time teaching doctors and nurses to teach you how to use your inhalers. There are so many inhalers on the market at the moment. I've got a big bag full. So this is just one small bag that I've got with some devices in. But the most commonly used one, you will see, is one like this. Will become in lots of different colours. And it's got a spray that comes out. And patients do lots of wonderful things with these. They spray their chests, they spray their neck, they use it as hairspray, and it has to get into your lungs. So if you do have one of these inhalers, we strongly recommend a spacer device. So it is important when you go for your review that you take your inhalers with you. So when we're there in the surgery, we can see how you use them. Because if you're taking it regularly, but you're not taking it correctly, it's not getting into your lungs. So that is really, really important. So it's going for your review, it's taking your inhaler correctly, and it's taking it when you should, and not over relying on your blue inhaler, because that isn't the important one. It's your inhaled steroid that treats this inflammation in the airways. We also know, as already has been said, that is really important is stopping smoking, it's exercising, it's good diet, and it's maintaining a good weight is really important. Now, for patients who've got COPD, the important factors there are, again, the things that you can change. So exercise. Now, we offer all across the Black Country classes called Pulmonary Rehabilitation. And I strongly advise that you attend these. It's twice a week for 6 weeks. And they are starting again up at the end of this month. So your practice can refer you. We also have groups called Airtime. But things going out for a walk and doing some form of exercise in your garden, standing and sitting in the chair up and down is really important. And obviously, again, vegetables, fruit, important. Protein is really important because as the COPD can progressively get worse, you can lose muscle. So it's really important to have good amounts of protein in your diet. So the main message for me is the most important things are looking after yourself and doing all the things that has already been mentioned that you can change and you can control. It's attending your annual review or your video link. And again, I've been doing quite a few virtual consultations, and we send a link out to the patient. And I've spoken to a couple of patients today, and they've said to me, oh, I'm just cooking the dinner, can you call me later? So it's a little bit difficult, so try and make time when the healthcare professional does call you, because we do have lists to get through. So if you can, I've just been asked a question how you access pulmonary rehab. Your GP can refer you. You can ask your GP practice to refer you to the service. We have a criteria, but it's really important. And again, I know Russ is coming on after me. Action Heart has lots to offer as well. So there are lots of services across the Black Country, across Dudley, that your practice will be aware of. So please use the resources. We train our healthcare professionals. We're working really hard in general practice, and we want to support you. We want to give you good care, and we want you to have a good quality life. And that is what our goal is in general practice. But a lot of it is dependent on you participating and being part of that, because as healthcare professionals, we can't do it for you. We can advise you, we can recommend, we can teach you how to use inhalers, but it really is to you then to ask us and use us as a resource. There's some excellent resources. Asthma UK has some excellent information, so you just tap into Google Asthma UK, and there's all videos on there of how to use your inhalers. There's all the latest information as well. And they do also have a service where you can telephone and speak to them for advice as well. We've also got the British Lung Foundation, again, an excellent resource that does do asthma, does COPD, and other lung conditions as well. So bronchiectasis, that is another condition, interstitial lung disease. So there are other respiratory conditions as well that you can seek on these web pages. But your general practice, your GP surgery is there central to your care. We liaise with the hospitals, we liaise with all these different areas, and we are all there to support you. And myself and Dr. Hopkin, we oversee all of the practices, and we link with the Black Country. We're always open to ideas. So I always say to patients, if you have an idea, share it with your clinician, and we can then feed that back to you. One of the big things that is really important is stopping smoking. So we know that stopping smoking is the main factor that will stop lung function decline. So if you do smoke, the sooner you stop, the better impact that it has. So, and there are smoking cessation services that can help you, Healthy Dudley, and I'm sure Russ will make reference to that as well. But again, all of this information is available at your GP practice. So I haven't really, I think I've covered most things that I want to say in the time. So just to summarise, make sure you're taking your inhalers as you should take them, so as they're prescribed. Make sure you can take your inhalers correctly. Make sure you attend for your annual review. And if you have any concerns at all, you've got your appointments that we can do virtually, by telephone or face-to-face, and try and maintain the time that you are sent out to do so. And any suggestions you have, then I'm happy for you to share them in the chat, and they can be fed back to me, and we can repeat that. We can work then across Dudley and across the whole of the Black Country, and also feed into nationally as well. So thank you very much, and I hope that's been helpful.
Thank you, Jo. I did put a note out to everyone as well, just to let them know that I know you had a prior commitment, so unfortunately I know you can't stay for the questions and answers, but we do want to just thank you for your time this evening and all that sort of comprehensive and really important information. Just a reminder to participants that we do have the Healthy Communities CDW email box, and I'm sure those questions can go to Jo, and Jo, that you'll be able to respond another time if we can't answer any of those questions tonight. Thumbs up, that's great. Thank you again, Jo, and safe travel. We'll hand over now to Russell. Thank you.
Thank you. Good evening, everyone. Hopefully you can all hear me. It's lovely to be part of this event. My presentation is with regard to physical activity, and in that respect it's going to be a little bit of a 10-minute sprint. I've been quite ambitious with the number of slides, so do bear with me. Next slide, please. Brief overview of the presentation. I'm going to talk about the good news, the not so good news, the pandemic news, the practical news, and finish with the Dudley Action Heart news. Next slide, please. The good news is that we have a really good idea of how much physical activity we should be doing to protect our health and well-being. And this is the same the world over. It's endorsed by the World Health Organization, and it's relevant to us all, whether we have an underlying health condition or we have an unblemished health record. And as it says on the World Health Organization website, it's irrespective of gender, race, ethnicity, or income level. Next slide, please. So what is this dose of exercise that's required to give us this protection and health and well-being? It's 150 minutes of moderate intensity physical activity, which I'll come back to, or 75 minutes of vigorous intensity physical activity, a combination of the two, and ideally taken in bouts of 10 minutes or more to reach that level. And just to mention very quickly, this dose of exercise is per week. Sometimes I scare people, they think they've got to do that much exercise every single day. So I'm glad to report that that's not the case. Next slide, please. As I mentioned, the message is the same, whichever country you're in, and it's been adopted by many countries, including, in this instance, the United Kingdom. This is a message from our Chief Medical Officer. And if you can look at the slide, it tells us if we achieve this dose of exercise, we're likely to have less cardiovascular disease, less type 2 diabetes, less cancers. It tells us that every little bit that we do counts, every minute counts. And in the bottom left-hand corner, it also encourages us to spend as little time being completely sedentary, sitting down, lying down, when we could be up and moving about. So that's a message for us to remember. Next slide, please. Just a brief description of what moderate intensity, we should be doing 150 minutes of moderate intensity per week. So this type of activity is when you're working hard enough to raise your heart rate and break into a little bit of a sweat. You're working at a moderate intensity if you're able to talk, but unable to sing the words to a song. And generally I say to people, for most people, moderate intensity is just about brisk walking, walking with a purpose. Next slide, please. Vigorous activity is where you're breathing hard and fast, your heart rate has increased significantly. And if you are working at this level, you won't be able to say more than a few words without pausing for a breath. And I generally say to people, very brisk walking or walking as quickly as you possibly can is a vigorous intensity. So that gives you a little bit of a guide. Next slide, please. Coming on to the not so good news, there's population survey after population survey looking at our activity levels in the UK. This one is a recent one from Sport England, and it's telling us that only 63% of the adult population is actually achieving these minimum physical activity guidelines. And perhaps even more worryingly, almost a quarter of the population are even managing to complete 30 minutes of physical activity, let alone 150 minutes. This was published in April 2020, relating back to activity surveys that were undertaken in November of last year. Next slide, please. More not so good news is that the same survey tells us that on average, the BAME community, apart from the mixed race community, is less active, with only 61% of the BAME community reaching those minimum activity levels. And also from the survey, it shows that the West Midlands tends to be towards the bottom of the activity level tables when you look across England. So we can perhaps deduce from this that it's likely that our BAME community in Dudley are perhaps not as active in general as they should be. Next slide, please. Moving on to the pandemic news, we've heard very eloquently from Dr. Randa that BAME patients can be more severely affected by Covid19 coronavirus. We know that the more overweight you are, the less fit, the less robust you are, you're more likely to be severely affected by coronavirus. And it also follows that less active individuals are more likely to be overweight, less robust, and have underlying health conditions. Next slide, please. So I think there's a potential pandemic paradox here, that the BAME community probably have a greater incentive to be as active as they can be and reach those minimum guidelines, but also they have an incentive to stay safe, and it's understandable that they're perhaps being conservative with that, and they're perhaps staying indoors and perhaps becoming less active than they were previously, which is obviously going to be a potential problem. Next slide, please. So the practical news, I know you've heard talks in recent weeks, but the good news is that seriously every little helps. There's been lots of research done, even looking at the difference between standing up compared with sitting down. And there are some very significant health benefits that can be gained just by making this simple switch. Next slide, please. For example, from a weight management point of view, if you stand up for an hour compared to sitting down, you're going to use an extra 50 calories. So if you manage to stand up a lot more, if you manage to stand up, for example, for 3 hours a day, 5 days a week, that will use 750 calories. And if you manage to do that for 52 weeks of the year, that's an extra 10,000 calories that you've used up, which is the equivalent of running 10 marathons. So some quite subtle changes to your physical activity, daily activities, can have a really profound effect on your health and physical activity. Next slide, please. I think from a practical point of view, for most of us, if we haven't got our normal outlets and our normal sporting activities, then walking is perhaps a very practical way of making sure that we're hitting those minimum activity guidelines if we can. So, for example, if we're walking at a moderate intensity, we'd perhaps need to do a 20 to 25 minute walk on a daily basis, be reaching the minimum activity guidelines. Perhaps if you're just starting to be more active, then you might want to do that in 2 different sessions. So you might do 2 daily walks of 10 to 15 minutes, and by the end of the week, you'd have hit those minimum activity levels. Or if you are able to walk vigorously, then that would be a daily walk of 10 to 15 minutes, walking at that intensity where you can't talk without your breathing interrupting your sentences. And if you're not able to get out of the house, then perhaps looking at the NHS physical activity videos, which provide some very good information on staying active in your own house. And I think that was discussed last week as well, is perhaps a good place to start. Next slide, please. Also, if you're fortunate enough to have a garden, then we know that there's some very important fitness gains to be had by undertaking gardening. It can help our cardiorespiratory fitness, it can help our muscular endurance, our muscular strength, improve our flexibility and balance. So for some people, it can either form all of their physical activity program to reach those physical activity guidelines, or it can be just part of your physical activity program. Remember, the more activity we do, the better. Next slide, please. Again, from a weight management point of view and just comparing exercises, if you mow the lawn for 30 minutes or you're chopping wood, digging, planting, raking for 30 minutes, the energy that you'll expend undertaking those activities is equivalent to 15 minutes jogging. So exercise and being active in the garden can be really, really helpful. Next slide, please. So all types of gardening potentially helpful, and there are also other benefits to be had, satisfaction of seeing your plants grow, or if you're growing your own veg at home, having the production of healthy food, and that all makes us our mental health that little bit stronger. And we know that our physical health and our mental health are working in harmony, so one can help to improve the other. Next slide, please. So to finish off with, I have the Dudley and Action Heart news, and just to say that Action Heart and Dudley Public Health have a long-standing partnership in providing services, physical activity services to individuals who would benefit from increasing their physical activity levels. And our work has actually been recognised and highlighted by the Department of Health. Next slide. The services can either be there to help individuals with existing health conditions, for example, patients with cardiovascular disease, perhaps had a heart attack or heart surgery, a stroke, people with cancer, with respiratory conditions, people who are very overweight. The list is really endless. It can also be for individuals with a number of risk factors. So they might have diabetes, be smokers, have high blood pressure. So having a cluster of risk factors or lifestyle factors can also be a reason for coming into the exercise referral scheme. Those individuals that perhaps haven't been active for some while and they feel they might need some support in regaining their confidence in their physical ability can be referred into the exercise referral scheme. And we've just started receiving our first COVID-19 referrals. We're working with the respiratory department at Russell's Hall Hospital and with the pulmonary rehab teams, and with the long-term conditions team, with Joe Hamilton in the community as well. And we have a pathway that is available for people with COVID-19 to help them regain their physical activity levels as well. So if you know someone that's recovering from COVID-19, then do ask them to be referred into the exercise referral scheme, or talk to their GP to get that support. And to get referred into the exercise referral scheme, it's very simple. Most health professionals that you'll be in contact with, whether it's your GP, your practice nurse, hospital consultants, Solutions for Health, other health professionals that are out in the community, all of them should have good knowledge of how to refer to the exercise referral scheme. Next slide, please. Action Heart are the gatekeepers. If you're referred in, then we can have a look, and when we have a one-to-one consultation with you, we can decide what might be the best exercise station for you to be referred to and supported by. We have excellent contact with the leisure centres in Dudley, the outdoor gyms, the activities that go on in the parks and so forth. The list is really endless in some respects. Next slide, please. And also just to say that one of the options is to exercise for 12 weeks. It's completely free of charge at the Action Heart Centre at Russell's Hall Hospital. You can attend 3 times a week. If you require any medical screening before we take you on to exercise, that's all part of the service. You'll have extra excellent support and supervision to start a planned and progressive exercise programme. And you don't have to undertake all of the exercise at the Action Heart Centre. We can also advise people how to be independently exercise if that's your preference. Please do think about being referred into that service as well. Next slide, please. So just to finish with, by means of a summary, the good news is that we know exactly what the dose of exercise is that's required. And if we can attain that, we're likely to be rewarded with better health and well-being. Every little bit helps, so the more active you can be, whether it's standing up rather than sitting down, that's all going to be really helpful. Every minute counts. Every minute that you're on the move is going to contribute towards that 150 minutes of activity every week. If you're starting from quite a low base, it's always sensible to build up carefully and do that, making sure that you feel that you're feeling in control. And just to finish with, to say that if you feel that you would benefit from support, then speak to a health professional about getting referred into the exercise referral scheme. Thank you very much. And I think I'm handing over to Kuldeep. So Kuldeep, over to you.
Thank you, Russell. Just waiting for Archie. Yes, that's great. Thank you, Goldie.
Thank you very much. Thank you, Russell Tipson. Good evening, everyone, and thank you very much for inviting me. And as you can see, I'm Kuldeep Chana, SMP Assessor from BME United. I am going to be talking about, I think it is on my, I'm going to be talking about long-term conditions, but I've added acute condition disease as well, and chronic COPD, chronic obstructive pulmonary disease. Acute disease is a disease or a disorder that lasts a short time, comes on rapidly, and is accompanied by distinct symptoms. This could describe anything from a broken bone to an asthma attack. And the long-term conditions or chronic diseases are conditions for which there is currently no cure, and which are managed with drugs and other treatment. For example, diabetes, chronic obstructive pulmonary disease, which is COPD, arthritis, and hypertension. Long-term conditions also tend to change over time. So the role of the doctor becomes one of a teacher more than a doctor. It is like a teacher and advisor while we become partners, and responsible for managing our condition on a daily basis and informing the doctor of our treatment preferences, which is very, very important to keep in touch with the doctor and update the doctor about your conditions. Next slide, please. What is COPD? Joanne Hamilton did talk in depth on COPD. I'm just going to give just a little talk on that. Chronic obstructive pulmonary disease, which is COPD, is the name of a group of lung conditions that cause breathing difficulties. Next slide, please. The main symptoms of COPD are increasing breathlessness, particularly when you are active, as in walking or in running. A persistent chesty cough with phlegm. Some people may dismiss this as just a smoker's cough. People who have been smoking for a long time, they usually dismisses it as a smoker's cough. Frequent chest infections and persistent wheezing. Without treatment, the symptoms usually get progressively worse. There may also be periods when they get suddenly worse, known as a flare-up or exacerbation. Next slide, please. So when to get medical advice? When see a GP if you have persistent symptoms of COPD, particularly if you are over 35 and a smoker or used to smoke. Do not ignore the symptoms. If they are caused by COPD, it's best to start treatment as soon as possible because your lungs become significantly damaged. So if you leave it for a longer period of time, not getting in touch with your GP, not getting any help, then obviously your lungs will get more damaged. The GP will ask about your symptoms and whether you smoke or have smoked in the past. They can organize a breathing test to help diagnose COPD and rule out other lung conditions such as asthma. Next slide, please. Causes of COPD. COPD happens when the lungs become inflamed, damaged, and narrowed. The main cause is smoking, although the condition can sometimes affect people who have never smoked. Some cases of COPD are caused by long-term exposure to harmful fumes or dust. People working in factories and dusty places, that can be a cause of COPD. Others are the result of a rare genetic problem, which means the lungs are more vulnerable to damage. To find out more about the causes of COPD, you can visit www.nhs.uk. Next slide, please. What should I do if I have COPD, especially during COVID-19? Make sure you're managing your COPD well. As previous speakers have already highlighted it. take your usual medication and inhalers as prescribed. Make sure you are using your inhalers correctly. That's very important. Continuing with your usual exercises, including pulmonary rehabilitation. And then there is a website, which is www.gov.uk/coronavirus to get advice about coronavirus. Next slide, please. Thank you very much. Thank you for listening to me, and thank you.
Thank you, Kuldeep. We go straight to Anne now. Thank you.
Thank you.
Hello, just to say thank you to a really for a really interesting set of presentations. So thanks to all 4 of our speakers. It's been good to have you with us, and thank you for persevering with the technological issues that we had earlier. We've had a very interesting run over the 3 weeks. We're starting with the identification of the BAME communities being so badly affected. Moving on to learn in much more detail about the diabetes, and then tonight hearing about the respiratory conditions. But one of the common themes has actually been that while there are things that we can do for ourselves, there are things that we can do together, but it's a balance between the two. And one of the things that struck me tonight has been the partnership working between us as patients and our doctors and nurses and healthcare professionals and physical instructors, and how if we can collaborate with them, it's in our interest for our own health, and how we've worked together as communities, we heard in week 1, so that Dudley actually had one of the lowest rates of coronavirus in the Black Country. So it shows what we can do separately for ourselves, for us as a community, and for people together. We have got some questions, not so many as in previous weeks, but if you'd like to put any more on the chat, please do that, and we'll make steps to see if we can answer some of them at least. James, would you like to take over with one of the questions?
Lovely, thank you. Nice to see you all tonight. Thank you to all of the speakers. The first question that somebody asked was that there's been some new symptoms identified this week, particularly to do with rashes, and I wonder if anybody could tell us more about that, please.
Would Dr. Randa like to answer that?
Hello, hi, yes. Yes, thank you very much. So yes, there's a lot of new symptoms do sometimes appear, and the identification of rashes, although obviously I didn't mention it, but it's one of the few rare ones. And for example, in children, they do appear to have some rashes, and in other populations, not as much as children, but as you correctly, that new identification of symptoms do happen. As regarding symptoms of this, we do see people as well with neurological symptoms like dizziness and falls. But obviously, when I put the symptoms originally, I just put it as broadly. But there's always things as I mentioned earlier, is ongoing learning about what to do. There's people coming with confusion, people coming collapses, a lot of symptoms. We still work on that as well. Possibly you might have seen recently about some people coming with severe neurological symptoms. They're not as often, but we do see them. And we keep an eye on things, and when you come to hospitals, we do assess all of the possibilities. Thank you.
Thank you so much. Thank you. The next question, actually, two people asked this question. I think could be summed up in what might communities do to increase their activities, but maybe if they're scared or they're worried about being around other people because of the social distancing, what kind of measures are available to allow people to do that? Are any of our speakers able to answer that question, please? Russell, is that anything that you could answer, please?
Sorry, I've just been able to unmute myself, James. So
sorry, apologies.
Okay. I think, can you hear me?
Loud and clear, yes, please.
Okay, super. Yeah, I had a couple of questions along those lines. Yeah, it's that paradox, I guess. I was speaking to a colleague of mine, actually, and he's from the BAME community himself, and he said that really it's just consider that to be another potential risk factor, just as it would be if you had an underlying health condition or you were overweight, and just listen to the guidance that's out there closely and make sure that you're following that as diligently as you can. I know that we're trying to open the outdoor gyms fairly soon. There are activities going on in the parks with some supervision and guidance for people that would appreciate perhaps having that little bit of guidance. And in terms of the leisure centres and the Action Heart Centre at Russell Hall Hospital, we're hoping that they're going to be available during August, probably mid to the end of August. So anyone that's seriously worried about their health and undertaking physical activity, perhaps now's a good time to start thinking about having a referral into the service so that we can be there. We'll any referrals that we're receiving at the moment, we're making contact with them. We're having a telephone consultation, giving them any advice we can over the telephone, any individualized advice. And then if they're interested in taking advantage of the 12-week supervised program, then we'll be back in contact with them as soon as we can meet with them face to face.
Lovely. Thank you so much, Russell. I think Anne's got a couple of questions now.
Yes, thank you. I'm hoping that Joe is able to join us remotely to answer this next one. I'll read it out so we can all hear it. And then if Joe's not able to, Dr. Randa, would you be able to give us some clue to the answer? The question is, are you able to show us any simple breathing exercises that could be done for those with existing respiratory conditions who do then go on, sadly, to contract COVID-19 and that then exacerbates their respiratory condition? Joe, are you able to hear that? I can see you, Joe. Thank you.
Hi. Yes, thank you very much. There are, I think it's important with breathing exercises that it is all part of a program, and this is where attending some sessions and pulmonary rehabilitation and the exercise referral can help with that. But there are some exercises on the British Lung Foundation website. So I think it's about having a look at what's available on the British Lung Foundation, but also being taught by the physios is what is really important, because good breathing techniques can make a huge difference.
Can you say a bit more about, Joe, about why they make a huge difference?
Well, any type of exercise to control breathing is really important for management of any, whether you have a long-term condition or not, but particularly when you've got a long-term condition, breathlessness is a key factor in asthma and COPD. So being able to control your breathing will have a big impact. Otherwise, you can get into this cycle where you can start to panic, it causes anxiety and can lead to a lot of distress. So therefore, good breathing control is really important, but having good breathing techniques as well. So being taught correctly. So access to services that are there.
So is it worth people, if they've just been a little bit too busy, to kind of really take a close look at their use of, say, inhalers or their breathing and their appointments, that they actually do get themselves booked in for an MOT, perhaps? Can't hear you, Joe, sorry. Can we unmute Joe, please? So perhaps we can look at the exercise that James now found the link to the British Lung Foundation page for support for your breathlessness and how to manage breathlessness now. Okay, another question. Is it worth getting an oximeter for... Another question for you, Joe, I think.
Yes,
here.
I'm unmuted now.
Okay, lovely. Thank you. Carry on.
There's a big debate around pulse oximeters. So if you're advised to get a pulse oximeter by your healthcare professional, that is something definitely to discuss first. We wouldn't recommend people going out or going onto eBay and suddenly purchasing pulse oximeters. Because it's how the results get interpreted. So if you don't understand the readings, it can cause more anxiety. But we may be looking at some projects where we will be providing them to certain patients. So my suggestion would be to discuss it with your healthcare professional, your GP, your practice nurse, before going out and purchasing one. Because we have had patients who they cause more anxiety than they help. So it's something to discuss first of all.
So that's another reason for people checking in again with their healthcare professional if they haven't been seeing them for a while, perhaps.
Absolutely, it's fundamental. It's key to attend your review virtually, by telephone, face to face. It makes a big difference.
Thank you for that, Joe. Earlier on, we had the paradox identified between the need for extra exercise, but also the fear of going out and thinking that you'll be safer and protected from COVID if you don't go out. So what might communities do together to increase their activity safely? Russ, would you like to go first with that? And then perhaps I'll ask Caldeep if she'll follow on as well with her community experience.
Sorry, what was your question?
If Russell goes first, and then I'll give you the same question,
right,
Caldeep. All right.
Okay, all right.
Okay. Yeah, I think the paradox is there, and although it's understandable that the BAME community perhaps have had that extra burden to carry with them, but really, if they don't have any, especially if they don't have any underlying health conditions, then there's no reason that they shouldn't be going out and walking and taking advantage of getting out the house and getting the appropriate amount of physical activity in. Obviously, if you want to work as a group, that's a little bit more difficult. You can obviously exercise as a household, and you can walk without social distancing in that case. But if you're meeting up with another household, which is within the regulations at the moment, then you would still need to keep the social distancing as you're taking physical activity. think that there has been a little bit of research that shows that if you're walking behind someone, the air that you breathe out can travel that bit further if you're walking into it. So you perhaps want to keep a little bit more of a gap than 2 meters if you're walking directly behind another person. That might be worth bearing in mind. If you're side by side, then the 2 meters would be fine. But I think if you can, you know, I think for a lot of people in the BAME community, you know, the risk of deconditioning and becoming inactive is going to be more of a disadvantage to them than being appropriately active, providing that they're following those you know, the guidelines that are in place at the moment.
Thank you, Russ. So, Kuldeep, from your point of view, what do you think communities can do to work together to increase their level of physical activity safely?
What I find in my area at the moment is a couple of friends are getting together, meeting in the parks, and obviously keeping in mind social distancing, and obviously wearing masks, and it's like meeting friends as well after a long time, and keeping social distancing, and doing exercise as well. So every Friday, some of my friends meet up in parks, and they do exercise that way. But otherwise, at the moment, as everyone is so scared and being at home, obviously they wanted to come out. And they have been doing that, and I have been invited for the walks as well. But I do get plenty of exercise otherwise without meeting my friends. I was supposed to go today as well. But they are keeping all this social distancing in mind, and enjoying as well. So that's another way of keeping fit and getting out of the house. So that's what our community here is doing. And I mainly work with Asian communities, running these sessions, SLP sessions. And I find that no matter how much we drum into them, that exercise is important for them. They still don't get it. But after my sessions, they have started exercising, and they find it very useful, especially ladies who don't get chance to go out. And when they come to these sessions, they... Hello.
Thank you ever so much, Kuldeep, for that really helpful answer, and to hear the excellent example of the ladies meeting together for their walks. So friendship and physical exercise, and being out in the open air, benefits of physical and mental health working in harmony, that Russ had mentioned earlier. Well, our time has come to a close, really, and I'm going to hand you back to Jackie.
Thank you.
Thank you, Anne. Thank you, James. And thank you most of all to our speakers this evening again for such you know, thorough, important, comprehensive information, and also thinking about where the gaps are in terms of what we can do for ourselves. As I say, we want to really hear from the community as well. So just before we finish the recording, I just want to remind people of next week's session, and then we can have the short meet and greet. So for next week, week 4, it's a focus on mental health and well-being. and this is going to include young people. We also have some sensitive areas, but it's important to cover these areas, but we did want to just kind of mention the sensitivities beforehand, because there will be a session on suicide prevention, and also staying safe, which links with what we've seen, in the media around domestic violence. So those, that will be the mental health session next week. Thank you. So if we can stop the recording there.